Guys, welcome to the first episode of Solve Questions with me, BSS. So, what we hope to achieve with this questions with you on every chapter and kind of take you through the approach we use and show you some tips and tricks that would help you as you navigate your university exams or even the USMLE STEP exams. Okay, so I hope we have fun with this. So, this is chapter one. We're on evidence based medicine. So let's go with the first question. We have a 4-year-old Qatari boy with cerebral palsy experiences several seizures at midnight, leading his parents to take him to the ED. The doctor on duty stabilizes the boy and plans to start him on an anti-epileptic drug. Now they're asking which of the following sources offers the strongest evidence to help the doctor to prescribe medication confidently. So, the first thing I want you to realize is that this question is testing your understanding of the evidence pyramid. So, we have an evidence pyramid, which is basically a pyramid that looks like this. Let me grab my pencil. Okay. So, we have a pyramid that looks like this. All right. So, this is the evidence pyramid. And then we have the different study designs in this pyramid. So, the main point or the main concept of this pyramid is that as we go up the pyramid, the level of evidence gets stronger. So, here at the bottom, you're going to have things like people's opinions, people's ideas, and then as you go up, you're going to have our observational studies like cross-sectional, cohort, case control. As you go up, you're going to have the experimental studies like, let's say, RCT or quasi-experimental. And then right here at the top is where you have your meta-analysis, which is basically when you're analyzing a bunch of studies together. So here at the top of the pyramid, we have our meta-analysis of systematic reviews. Okay, so this offers the highest level of evidence when it comes to the evidence pyramid. So this is roughly what the question is asking about. So we're going to go with this one and let's see how we did. Okay, so this is correct. The question is about finding the most reliable evidence, and this is offered by meta analysis and system. So here we have a woman who's 37 weeks pregnant about the need for vitamin K for her newborn baby to prevent hemorrhagic disease. The woman, however, declines this advice. What principles should the doctor's advice be primarily based on? So, the main point about this chapter is that as we practice medicine in our different fields, be you a doctor, a nurse, or any type of healthcare professional that you are, we need to practice evidence based medicine or evidence based healthcare, which means everything that we do is guided and backed by evidence, which forms our guidelines. All right. So, if we have a doctor who's advising a patient on something, for example, to take vitamin K shots for the baby, this is backed by evidence because we know that newborn babies have immature livers that are unable to synthesize vitamin K and stuff. All right. But the main point in this question is that the doctor's advice should be based on evidence. So that's why we're going to go for. So let's move on. Okay, this is a bit long, but let's see what it says. We've got a first time mother visits her clinic because her 11-month-old child has head lice from daycare for the second time in a month. She asks for ivermectin tablets. Your research indicates oral ivermectin is the best treatment for recurring head lice, but not for children under 14 kg. You decide to prescribe topical permethrin cream and you recommend wet combing instead. Which aspect of EBM primarily influences your treatment choice for this patient? Right? So, what this question is actually talking about or trying to test is if you're aware about the three core components of evidence based medicine. So, in our notes and in our videos, we go through these three core components, which, when they come together, they form evidence based medicine. And the first one is the best available evidence. All right. So, where do we get the best available evidence from? We get it by, evidence that has been uploaded from other researchers based on the researches that they've done, based on the studies that they've conducted. Okay, so this is where we get the best available evidence from. And then the second component is the physician's judgment, or sometimes this is called as the clinical judgment. Right. This part is very important because you know that as healthcare professionals, you have to put into practice the evidence that obviously other people get from research. But the whole point is you just don't take evidence and blindly apply it to your situation because everyone is different. Your patients are different. Your patients might be very, very different from the patients on which this research was conducted. So, whatever evidence you're getting from available literature or from anywhere you're getting it from, you want to make sure that you're still using very strongly your physician judgment or your clinical judgment to apply those evidence, right? And this is very properly illustrated in this question because we know that, okay, if you want to treat head lice, right, according to literature, this is a very good medication, but you're not just going to blindly use it on a baby who's 11 months old. Why? Because this medication is not safe for babies under 14 kg. So you see how we're thinking about it. This is really your clinical judgment or your physician judgment coming into action. All right. So, what influenced your treatment choice? It was a lot of your clinical judgment that made you to recommend the screen and wet combing instead. Okay, so we're going to go for physician judgment for this answer. And just in case you're wondering, the last core component of evidence based medicine is the patient values. Okay, so let's see how we did and where are the rest of. Okay, so here we have clinical judgment. Excellent. So let's just clean up the page a little bit. Okay, and we move on. Okay, so here we have a medical intern is working in the obs and gynae department. In a morning meeting, we have a whole bunch of healthcare personnel discussing various patient cases and how the department handled those cases and potential improvements for the management and patient experience. Now they're asking, what is a reasonable outcome to expect after such a meeting? Okay, so the first thing that I want you to understand when you read this question is they're actually talking about something. And I hope that as you're reading this question, you realize that this is an audit. Why? Because this is you, you're the medical intern, you're in the Obs and Gynae department, you're having a morning meeting, and everyone we have doctors, nurses, quality control staff, a whole bunch of people sitting together and discussing, okay, these are the various type of cases we had. For example, in this quarter, this is how we handle those cases. This is the area that we're slacking on. We could potentially improve on this area. So what do we do next? So in essence, they're evaluating themselves. Okay, so when you're evaluating or where you're grading yourself, this is called audit. And I really hope that you remember that as we practice EBM, evidence based medicine, there is an EBM pathway. Okay, this is very nicely illustrated in the notes and in the video. So this is basically telling us that this is the pathway to practice EBM, and this pathway has different steps, right? The first one is asking a question. So you're going to take your clinical situation that you're facing and you're going to convert it into an answerable clinical question. So this is the first step. And then the second step is after you've asked a question, you need to acquire. This is where you acquire evidence, right? And then the third step is after you acquire those evidence, you need to assess them. You're assessing them for so many things. For what is your strength? Is it a strong evidence? Is it a weak evidence? Is it valid actually? Is it accurate? So you're assessing for so many things. Now, when you get the evidence that you're comfortable with, you're happy with, it's a good level of evidence. It's actually accurate. It's valid. You can apply this. Okay. Sorry, I meant to write apply. So that's the next step. You can apply this evidence, and then the last and the fifth step is audit. So when you audit, you're basically grading your application or your how you've practiced EBM. Are you doing it the right way? So in this question, you're basically saying that it's the department that is auditing their obviously evidence-based approach in handling your patient. So this is not really what the question is about. The question is actually asking, okay, after you've done an audit, what happens next? And if you realize that audit is all about evaluating yourself, and just like we said, you're going to have areas that you've done well, you're going to have weak areas that you need to improve upon. All right. So obviously, you need to implement all these changes and everything that you came up with. And then you probably should re-audit after some time, probably 6 months to a year, to find out if the changes that you've implemented, if they're going well or not. Okay. So our answer is going to be what we do after an audit is we implement changes and then we re-audit. Okay. So let's clear up the screen and see the answer choices. Right. We implement changes and we re-audit. Okay, so let's take one more question and we wrap this up. Okay. A pediatrics doctor in the US performs quality assessment research and finds that a hospital's treatment of bronchiolitis significantly differs from the latest American Academy of Pediatrics guidelines. This is not good. This has caused extended hospital stays and readmissions for many children. What is the reasonable explanation for the poor management of bronchiolitis in this hospital? All right, so in this question, you have a hospital that is obviously not following the guidelines that has been set in place. And you know that guidelines are very important because in a way they kind of aid you in the application of the evidence or the like the proper way to manage certain conditions in your patient. This is what guidelines are useful for. They basically guide you. All right. So if you have a hospital that is not following guidelines that are obviously based on evidence, based on research, then probably this hospital is doing something that is not backed by research, it's not evidence based, and is likely to fail. All right. So this is probably the main reason why whatever they're doing is not effective. And this is the reason why, even though they might discharge a patient, you see a lot of those patients coming back to the hospital with readmissions or staying for a very long time in the hospital because they're not getting well. So the whole point is that this hospital is not following evidence-based approach and consequently their patients are suffering from it. All right, so we're going to look for this among the answer choices. And what do you know is the first one. Evidence-based treatment is not pursued. Okay, so let's see how we did. Excellent. All right. So that is all from me today. I hope this was a very quick review of evidence based medicine for you. And of course, this is just a tip of the iceberg. We have beautiful notes on evidence based medicine that is very colorful and is very detailed, but at the same time, it's very, very simple. And then we have amazing videos where everything is explained in very simple language. And then, of course, we have the whole question bank to help you really master this topic. So, this is just a very quick, blazing review, just to show you how we approach thinking about these questions. All right, so that is all from me today. See you in the next video.